Today we're going to look at recognizing and preventing and reporting abuse. And I know this is something that we talked about when we went through our patient rights module, and we did look at reporting abuse at that point as well. But this is something that we really want people to have an awareness. People need to understand what's happening um, to people out there and to our elderly population, and things that we can do to help, and things that we can do to recognize what's happening and help the situation. As healthcare providers, we should be educating our community, educating our friends and family of what's happening in the world, what's the abuse that's happening, and resources and options and things that people can do to help stop this process. So when we're looking at abuse, one of the things that we're going to talk about is I want to define the 5 types of abuse. I want to make sure that you identify 3 factors that contribute to elder abuse, describe at least 4 things that contribute to abuse in nursing homes, and describe the healthcare provider's role in identification and prevention. So our elderly population, we've talked about this before, they are the largest growing population. Our baby boomers are the people that were born between 1946 and 1965. So that is a huge community of people right now that are getting older. There are 40 million people over 65 right now in the United States, and that is expected to double by 2050. So we have to be aware that our elderly population is growing tremendously. And unfortunately, they're one of our very frail and fragile populations, just like small children are, our elderly population is as well. In elder abuse, 1 in 10 elderly are abused or neglected in some way. So it is suspected that for every case of abuse that happens, that's actually reported, that there are actually 5 cases that are not reported. So think of how much that actually is of things that are happening to our elderly population that aren't getting picked up, that aren't getting reported, that are going to just continue to keep happening. So the different types of abuse. There is physical abuse. And so physical abuse is hitting, punching, kicking. When we talked about patient rights, we were talking about assault and battery. Assault is threatening to harm someone. Battery is actually harming them. Sexual abuse, of course, taking care of or, taking advantage of an elderly person because they can't defend themselves or protect themselves and being harmed sexually. Emotional abuse, okay, just belittling them, making them feel like they're not worthy of anything. Neglect. Now, neglect we said was different than negligence. Neglect is not giving them the care and services that you know they need, not feeding them when they're hungry, not cleaning them when you know they're soiled. Okay, that would be neglect. Abandonment. Abandonment is taking a patient assignment, saying that you're going to be there to care for that person, and then just leaving them and nobody's caring for them. That is abandonment. So when we leave for the day, so when we go and we're working in the nursing home and we're taking our patient assignment, when we leave, you have to report off to the person who's going to be taking care of that patient when we leave. They need to know that you're leaving, what you've done, what you haven't gotten a chance to do, what kind of care needs to be followed up with. Financial abuse, and that is a very common thing that happens to our elderly population. People can take their finances, use their checking book, steal from them. So that is another type of very, very common type of abuse to see with our elderly population especially. So types of abuse, neglect is the most common. So when they've done studies on the types of abuse that are reported, and remember what I said, for every 1 case that is reported, they think there's 5 to even potentially 10 cases that are not reported. So neglect, they feel, is the biggest type of elder abuse. Over 58% of all types of abuse that are reported are neglect. So that is not providing them their basic needs: food, shelter, water, clothing, keeping them clean. The next over 15% is physical abuse, actually hitting, punching, kicking. That's going to be the next most common type of abuse. The next is financial exploitation. So financial abuse, stealing their money, stealing their belongings, writing checks out of their checking account when they're not aware of it. 7% is emotional abuse. And then we have sexual abuse is actually a very small component of it. Sexual abuse is actually, not even 1%, and then just a little over 5% are just all other types of abuse combined. So it's something that, we need to be aware that this is happening. We need to realize how commonplace it is and what type of abuse is happening for these people. So who is at risk? Well, women more than men. I mean, women tend to be a little bit more fragile um, than men are. They're generally physically they're less strong than a male is anyway, and so generally we see women being abused more than men. People with low social support, people that don't have family checking on them and friends coming by to check on them. Okay, those people are going to be more at risk. Your patients with dementia, people that aren't even aware of what's happening to them. So they have poor cognitive function. So dementia means loss of cognitive function, and that we said is our ability to think and rationalize. So if we don't have good cognitive function, if we don't realize that we are being abused, okay, because that person has dementia, and it is a type of basic disability, right? And so now they're being abused, and they may not even be aware of it fully, or even if they do complain of it, sometimes people just kind of poo-poo them and think, oh, they have dementia, they're not aware of what's going on. People with functional impairment, low economic status. So they have found that people that have less education tend to have a higher risk of being abused than people who have better education. People that are socially isolated. So we already mentioned low social support. It's kind of the same thing, but people that are socially isolated from others, and people that are dependent and impaired. Okay, are dependent and impaired elders. That's another common area that we see it. So as far as who's the abuser, my students are frequently surprised by this, but the biggest bulk of the time it is family members. So people think that abuse generally happens in the nursing home, and there is a certain percentage in the nursing home that does happen, but it is more common in the home setting. So it's more common for a family, for a child or a spouse to abuse their family member. And it's more common for males than females to be the abuser. Sometimes a paid caregiver that comes in. It's a paid caregiver that doesn't necessarily have any official training, but they've cared for people before and they're coming in to help out. And sometimes they will be the abuser. Frequently, substance abuse is involved. And the more dependent a person is, the more care that's required, the more stress that family has. And the more stress, the higher the chance is going to be. You have to remember, it's very difficult to care for someone else. It's very difficult day in, day out to have someone maybe not know you or be demanding, or you clean them up and then they're incontinent again, and it can be very frustrating. And the people that are caring for them, they don't have training. They don't really know how to do this physically or emotionally, how to take care of this. And so it is a huge stress on them. And some people do not know how to deal with stress, unfortunately. Common types of abuse by family is neglecting basic care and the financial abuse. Those are the two most common things that are going to happen on abuse with our elderly, and again, generally from the family member. Now, the term self-neglect, it's where you choose not to take care of yourself anymore. So person's not eating anymore, or not eating properly, wearing filthy clothes, a filthy home, they're not getting medical care. And so this is something that, does a person have a right to this? Does a person have a right to do self-neglect? So a lot of times when self-neglect is happening, sometimes the police or there will be a call to Adult Protective Services to go check the welfare of an elderly person, and they find them living in filth or rats running around, not any food in the fridge, and the person's obviously not doing very well or very healthy because of it. And they'll try to get them to come in and get medical attention. But even sometimes when they do that and then they let them go back home, they may choose to go right back into the lifestyle that they had before. Again, if the person has cognitive function, and that's the big key, if a person has cognitive function, they have the right to refuse care. They have the right to refuse help. So self-neglect, sometimes people do this to themselves. Common characteristics: alcohol and drug problems, women who live alone, people that have a history of depression, and are very frail and are very elderly again. So signs of elder abuse. What type of things might we see? What type of things might we notice? So a sudden change in behavior. So now where they used to not go out of the house unless they were perfectly groomed and their lipstick was on, now they have decreased grooming. They're staring vacantly. They're crying all the time, or they're depressed. You might notice discrepancies in finances. Sometimes that's how things get picked up. Someone comes in to help them with their books or their finances and realizes that the caregiver's been taking money out every month or using their cards to withdraw money out of the ATM. They're withdrawn or they're fearful around certain people. Okay, they actually seem to be afraid to be left alone with someone. They may be malnourished where haven't been fed enough and haven't been given the opportunity to eat properly. Now again, this can be from self-neglect as well, but it can also be from just neglect from the family members, not caring for them properly. Now, I will tell you, when people get admitted into the nursing home, we have talked about some people go through what we call failure to thrive. They get so depressed that they're put in the nursing home that they just kind of quit eating and they kind of give up on life a little bit. And it's something we always have to watch for because, again, we cannot force somebody to eat if they have cognitive function and they choose not to eat. That is not something we are going to be able to necessarily fix. But if we're seeing the person is becoming malnourished because they're choosing not to eat, we can always get them some emotional and psychological support, hopefully, to help get them through this. But when a person's at home and the family members aren't even providing the necessary food, that obviously would be neglect. Physical injuries, so noticing bruising, noticing skin tears and things that don't really add up to what they say the story is. So it's something that you're noticing all these injuries on the person and you ask about it and the story just isn't quite fitting what you're seeing, okay? That is a sign, obviously, of elder abuse. Frequent urinary tract infections or vaginal or anal bleeding, okay, can be signs of sexual abuse. Medical needs not being attended to, and the caregiver isolates the person. They won't let any friends or family, or neighbors come over and see them. They keep them completely isolated so other people can't see what's happening. So if you're ever concerned about a neighbor, a family member, something that you're thinking, this doesn't look right, you just need to make a call. Now, in a nursing home, we would call the ombudsman or we can call the police. For out in the community, we would call the police, would be fine, or we can call Adult Protective Services. And they'll come out and check the person. They'll just come out and check their welfare. So how do we prevent abuse in the community? One of the things is social support, connecting elders at risk to local and community support services. And there are support services out there. There's caregiver support, there's elder support, there's daycare centers for elder if people just need a break. It's very difficult for family members to care for a loved one. It's very stressful to care for a person that has dementia or that has multiple disabilities, and that starts becoming your entire life. And it's stressful even for a healthcare provider to take care of them when you're going to go home in 8 hours. So think about this person who, this isn't what they had planned on, and now they're having to care for a family member day in, day out, sometimes without any break. So we need to connect these people with some social support. There are community groups for caregivers to deal with the stress, to help bounce ideas off and just know that there's other people out there that understand what they're going through and can help them, maybe give them ideas of how they can cope a little bit better. So we can try to connect them with caregiver support groups. There are what we call respite care available for people, and respite care is when you contact these support groups and they will send somebody out to help care for your loved one for a few hours so you can just take a break, so you can just breathe. You can go out and get your hair cut or go to the movies or, whatever it is you need to do to just have a time for you to be able to get away and just kind of decompress and recharge a little bit. as a healthcare provider, it can be very stressful caring for people all day long. But when you get off work, you can go home, you can decompress, you can have time for you. When you're caring for a loved one day in and day out, you don't always have that luxury. But these support groups offer respite care. So there are a lot of different organizations where you can seek help from. Community awareness and education programs are very important to educate our communities that we need to help prevent abuse. We need to, if we see something, we need to say something. As far as institutional abuse in the nursing home setting or in a healthcare institution, the most common type is misuse of chemical or physical restraints. So with our home care setting, it's more neglect and financial abuse. In a hospital setting, it's more the misuse of chemical and physical restraints. Chemically making someone drugged up so they can't climb out of bed anymore, so they can't scream or cry or complain all the time. That would be a misuse of that's a chemical type of restraint. So you're going to find that most facilities have very strict policies on restraints. We try very, very hard not to put a person in restraint unless that is truly the only way we feel that we can keep them safe. We do not do it for convenience. We do not do it just because the family can't sit with them anymore and we can't be in there all the time, so we're going to tie them up. We really have to try multiple different alternatives. We have to try to do other things to keep our residents safe so we don't need to do physical restraints. The next type of abuse that you'll see in a healthcare setting is neglect due to poor staffing ratios sometimes, and most commonly by CNAs. And you guys, when you have poor staffing ratios, when you have a CNA who's got 8 patients, for instance, on day shift, and their patients all need to be fed and they all need to be cleaned and they're all incontinent, it is a heavy, heavy load. And you can only do so much in a day. So sometimes they find neglect happens just because staffing ratios aren't enough to get them all the help that they need. Now, last year they passed a new law that that nursing homes had to provide better patient care hours. And it was up to the nursing homes to decide what was the best way to do that. Do you put that in the form of CNAs and hire more CNAs so they have less patients? Do you get more licensed nurses in there? And it was up to the nursing homes to decide how they wanted to do it. And one of the nursing homes we go to, they put more licensed staff. They felt it would be safer to have more licensed staff working at the facilities. So there wasn't, medication errors. There were more nurses going around making observations, assessing patients. So they felt that was a better use of providing more care. Some of the facilities hired more CNAs so they could put the CNA patient to CNA ratio lower. And so it was really up to the agency to decide that. But because there was so many issues of can we really truly provide as good a care as we should with the way staffing was happening, the state law did actually enact last year to make them have to have more staff happen, at the facilities. Because if there's not enough CNAs and you don't have enough people to go around, how do you get everybody fed properly? If all 8 patients that you have need to be fed, how do you possibly get all of them fed and feed them well? Bed sores. How do you get everybody turned as well as they should be and cleaned all the time like they should be? And can you watch them as often as come by and check on them as much as they should be checked if you're so busy? So they were finding that bed sores, malnutrition, falls, and death were happening in the nursing home. And they really felt it wasn't because that the CNAs weren't trying to do a good job. It was just there wasn't enough of them to go around. So hopefully that has been corrected and hopefully that should start getting better. As far as prevention of abuse in healthcare, we have the Ombudsman's program, which we talked about. So there are ombudsman signs in the nursing homes, every nursing home that we go to, and it'll tell you if you see something that you're uncomfortable with, if you think abuse is happening, if you think residents' rights are compromised in any way, there is a number, and they've got the big poster on residents' rights and contacting the ombudsman, and anybody can do it. Patient's family, you, nurse, anybody can do this. The other thing they do to help prevent abuse in the healthcare settings is registries. So when you finish this class and you take your state exam and you pass, you are going to go on a National Registry. And this National Registry, they do background checks, and this registry kind of keeps track if there's a bunch of complaints against you, if there's abuse reports filed against you, that goes on your record with the National Registry. Now, if it's reported abuse and they find out it isn't abuse, then that doesn't. But if you have abuse happen, it's going to go on that registry. Anytime you go to any job to get hired, they're going to check the registry to make sure you're in good standing and to make sure that you haven't been convicted of any abuse. And if you have been convicted of abuse, you're pretty much done in nursing at that point. So what some people were doing that did have history of abuse, they moved to another area, they changed their name, and they went through a CNA program, got their new CNA license under this new name, and started working. So now they're doing fingerprinting. Okay, so with that background check, it's fingerprinted, and you get fingerprinted everywhere you get a job in as a CNA in a nursing home. Every agency you go to, they're going to fingerprint you, and you'll be live scanned so they can better track that and better monitor that. They post residents' rights in the nursing homes. So in the nursing home, again, there's big posters of what the residents' rights are. On admission, the person gets a form of here are your rights. Here are what our responsibilities are to you. Here's what you have the right to expect. And if you have concerns, you have the right to report it. And regular training on recognizing and reporting. Nursing homes are required to provide their staff with training on recognizing and reporting abuse. And then professional training on adult prevention. So when we report abuse, we report for a nursing home setting, we report to the police or the local ombudsman. If you're in a home setting, it would be the police or Adult Protective Services. If you're working with children, then we do Child Protective Services or the police. But preventing elder abuse and neglect, it requires us to listen to our elders. We need to listen to them and to their caregivers. We need to intervene when we suspect something. Don't just say, "Oh, I'm sure I'm wrong. This just can't be happening. I must be making a mistake to even think that." If you feel it, then maybe we need to say something, okay? When we're in the nursing home, I do recommend you talk to your clinical instructor and say, "This is what I'm seeing. It's making me uncomfortable. Do you think this is abuse?" And we'll talk about it. We'll talk about why it is or isn't abuse. And even if your clinical instructor does not feel like it is abuse, and you're still worried and you're not comfortable with the explanation your instructor gave you, then we'll make a report and we'll help you do it. Whether we agree with you or not, we'll help you do it. So, or you can report anonymously. You don't even have to talk to your instructor. You can, there's that SOC 341 form that we went over in the first couple weeks of school, and you can fill that out and contact them yourself. So we want to intervene when we suspect it, and we want to educate others. So listening is a big key. It's a really big key. Pay attention to what they're telling you. So when a person's telling you that something hurts or they're worried about something or something's happening to them, listen, okay? People need to be heard. So we'll listen, we'll intervene, and we'll help educate. And that we will be talking about abuse in more detail, and I am going to be showing you a video as well on abuse. So we'll go ahead and stop here with this section.